world, the novel coronavirus, which was later named COVID-19, became synonymous household words that signaled quarantines and lockdowns as countries globally battled a new threat. Part of a family of viruses, including SARS, MERS, and the common cold, COVID-19 is spread quickly from one infected person to another through sneezing and coughing, or by someone coming into contact with infected surfaces. To date, the best known defense is prevention. On this program, we are looking at how COVID-19 has affected the family and what strategic plans are in place by the Ministry of Social Development and Family Services to support families in Trinidad and Tobago. I'm Jaron Remy, and with me on set is Family Services social worker Farisha Mohammed. Joining the discussion online are Mrs. Jacinta Bailey Sobers, Permanent Secretary of the Ministry of Social Development and Family Services, as well as Mrs. Anuola Cox Olubade, Family Services social worker in the Division of National Family Services in the Ministry of Social Development and Family Services. Welcome, and let's get straight into the program. I'd like to kick things off by asking the Permanent Secretary at the Ministry of Social Development and Family Services about the strategic plan moving forward.
Thank you, Jaron, and also thank you for the opportunity to share with you and also with the listening audience about the Ministry of Social Development and Family Services, who we are and what we are doing for families. The Ministry of Social Development, of course, we have the remit of strengthening the social protection system, and in particular, the social safety net. As regards to families, our strategic plan was approved in 2018, and it actually covers a 5-year period of 2018 to 2023 and focuses primarily on poverty reduction, addressing inequality, and also addressing the issue of resilience, which of course is timely and relevant because at this point in time with COVID, we are looking at how resilient we are as a nation. And of course, the family, healthy functioning families, and how the ministry will be providing support to the family to empower families and also to transform family life. So essentially in the strategic plan, we are looking at areas that will focus on strengthening the family as an institution, which is of course the bedrock of the society, and also providing the support to vulnerable families, and very important, addressing the whole issue of values, attitudes, and behaviors that will enable us as a people to move forward towards our goal of Vision 2030, a developed nation. So
P.S. Can you tell me when is the rollout for the strategic plan?
We have commenced the rollout and the implementation of our strategic plan. Internally, we have a committee which is responsible for the different aspects and ensuring that we are monitoring the implementation and of course identifying the areas of priority for implementation, of which one is the family. The other main area is poverty reduction and also the area of building resilience for the nation. So those are the strategic areas, and for the family, we have a very critical program that we are looking to implement called the Step Up program. I'm sure you may hear more about it as the social workers speak. Social transformation for empowerment. It means uplifting people, and it's all about strengthening the family and ensuring that every member of the family attains their potential and maximize that potential for nation building.
Thank you very much, P.S. Now, for those of you who may or may not know, from Mother's Day to Father's Day is the month of the family. And on May 15th, we celebrate International Family Day, or International Day of Families. And Farisha Mohammed, who's in studio with me, can you tell me a little bit more about what the International Day of Families means?
International Day of Families, it was first established in 1993 when the UN General Assembly, they came together and they identified that the family is the backbone of society. which means that the family system is very important to what happens in society. Then they embarked on it from 1994, where the International Day of Families was officially celebrated on May 15th. Each year there is a theme that is assigned to that day. Since then up until now, we also understand that when the UN General Assembly, they came together, they spoke about families and the importance of having a healthy functioning family, because it is also equivalent to healthy function in society. So that's basic general information concerning the history of it.
Okay, thank you very much. And I want to ask, and bring Anuola into the conversation and find out more about what the Division of Family Services has been doing in this month of celebrating families and generally for families and family services.
Thank you very much, Jiran, and good afternoon to everyone. At National Family Services, presently we have our radio program on I-95.5 every Wednesday from 1 p.m. And as my colleague shared, the program really highlights some of the issues that our families, come into conflict with. So what we normally do on the program, we highlight issues such as mental health, caring for the elderly, domestic violence. So the program not just share the information, but give ways in terms of how to cope, how to function effectively in dealing with such. So with respect to the International Day of the Families, our programs are geared towards such.
Okay, fantastic. Farisha, can you tell me a little bit about some of the usual happenings at the Ministry of Social Development and Family Services in terms of, I know you all do lots of workshops. Can you tell me some of the types of workshops that you do to help the families?
Okay, so on a yearly basis, the National Family Services, we roll out 2 workshops, mainly the lay responders to domestic violence as well as parenting workshops. However, as Aniola would have indicated before, we are limited in how we practice right now. So this year's theme, as identified by the UN, it's families in development. So based on that, it basically spoke about how families develop during this time, right? The pandemic, it affects everyone worldwide. So the National Family Services, we were limited in micro practice. So our division, we are unable to host those workshops. So what we have tried to do and what we are in the process of doing is the televised series as well as the radio program. So this year we had to do sort of adjustments to how we deliver our services, as well as the ministry has set up hotlines for us where we are directly available to the general public, where they can call in to receive psychosocial support. So whether it may be the issues of domestic violence, child abuse, or any related social issue, they can call in to us and we will be readily available. We have recently started back seeing clients on a one-on-one, where we limit them, obviously take the necessary precautions in order to have our services delivered. So basically throughout, even though the country was on a standstill, basically, National Family Services, we kept abreast of what was happening and we delivered to the general public just via means of working around the limitations that we were
and with
given.
the technology.
Yes.
All right, so I want to let you guys know that you are free to participate in this conversation. You're very welcome to call us at 622-4141 extension 4. And please remember, when you're calling in, to mute your television sets. So 622-4141 extension 4. Also, if you're logged on Facebook, you can send us a message at TTT Live Online, or you can send us a message via Ministry of Social Development and Family Services Facebook page, and we are very willing to engage. And you can ask either of the social workers that we have here or the permanent secretary if you have any questions about the strategic plan and whatnot going forward. You can feel free to ask as well. I have a question for the permanent secretary. In terms of the strategic plan, I know that it would have been in place and it would have been approved prior to the entire situation of COVID-19, but some of the features, would they have to be adjusted going forward? Piers?
some of the aspects of the strategic plan would have to be reviewed. Just to mention also that we have another strategic document, the National Social Mitigation Plan, which in fact is a plan that addresses the building of resilience in the population and also addresses how you mitigate the impact of shocks, just like the pandemic COVID. So actually, we were ahead probably of a lot of organizations in terms of our planning, because we now have a document that could assist us in the recovery effort. Whilst we have these two main documents, we understand that they will also have to be aligned to the recovery plan that government is also working on. We envisage that there may not be much that we have to adjust, because we are providing information and have been providing information to that committee, so that moving forward, we expect that we will expedite and speed up our implementation of the strategic plan and the social mitigation plan, and as we adjust it in keeping with the map that is being planned for recovery at the higher macro level. Essentially, I think we are spot on with respect to our plans for the impact that COVID has had on especially the vulnerable populations, and also in terms of strengthening the safety net a little more so that it's robust moving forward.
Indeed. Thank you very much, P.S. Farisha, you said earlier that, the family, well, I mean, the sentiment has been echoed across the board, is that the family is the bedrock of the society. Some people are still not aware of exactly how people have been affected. A lot of people aren't really aware of some of the effects of COVID-19 and the pandemic on the family life in certain areas. Can you tell me some of the examples? I mean, of course, we can't get into details of...
So in March of this year, when this pandemic had now started, and we had where the country was basically shut down in order to contain the virus, what had happened is that studies began where the various researches were being done. And within those researches, we identified that child abuse had gone up by 41% within that March month. And by April, domestic violence had gone up by 100%. So those are the two areas that we would have identified, as well as the division began getting a lot of calls concerning the abuse of elderly. So those are the three areas that I would say that, based on first-hand experience and what we would have been dealing with at the ministry within this time of the pandemic, those three areas are areas that were of grave concerns, and there was a drastic increase in the numbers of reports that were given out at that time. So those are the issues as well. Those were the social issues, but as well as we had other things, the economic factors that played, where persons were the poverty line, they fell under, and all of those things. So those were the issues that were prevalent within that time that we would have identified.
Wow, I don't even know where to begin dealing with that. You said 100% increase in domestic
violence, yes.
That is intense. All right, so I want to invite you to please feel free to call us at 622-4141 extension 4. You can get in on the conversation, and we'll be back after a quick break.
Know the ABCs of child protection. A. Always look out for abuse. B. Be aware of your environs and plan for safety. And C. Call the Children's Authority at 996 or Childline at 131 for help. Child abuse is everyone's business. A message from the Office of the Prime Minister, Gender and Child Affairs.
Protect yourself from COVID-19 novel coronavirus. Wash your hands frequently with soap and water, or use an alcohol-based hand sanitizer. Healthy me, healthy you, healthy Trinidad and Tobago. A message from the Ministry of Health.
End gender-based violence now. See it, stop it, report it. Victims or observers call the National Domestic Violence Hotline at 800-SAVE. That's 800-7283. A message from the Office of the Prime Minister, Gender and Child Affairs.
There's stories all around us. And as a filmmaker, I enjoy seeing stories unfold before my eyes. And sharing these same stories with audiences across the globe is a truly magical experience. And even hearing feedback from these same audience members gives me energy to create even more content. Okay? And that is why I support TTT. And you should too. Support TTT, live for local. Kelly, so you can come now. Get going. I'm Shari Petty, I'm a filmmaker and I support TTT. Support TTT, live for local.
Know the ABCs of child protection. A. Always look out for abuse. B. Be aware of your environs and plan for safety. And C. Call the Children's Authority at 996 or Childline at 131 for help. Child abuse is everyone's business. A message from the Office of the Prime Minister, Gender and Child Affairs.
Welcome back to the Ministry of Social Development and Family Services Focus on the Family. Remember that you can call us at 622-4141 extension 4. Today I'm speaking with Farisha Mohammed, Permanent Secretary Jacinta Bailey Sobers, and Anuola Cox Olubade, all of the Ministry of Social Development and Family Services. Now I want to throw to Anuola. I understand that you guys have been doing a radio program dealing with various aspects of family services. How has that been going, especially in light of the world pandemic that's happening?
Right. Our radio program has been very, very effective. The response that we got from persons immediately after the program, they have been calling our numbers at head office with various concerns. So we had persons like Dr. Jennifer Rouse that dealt with elder abuse. We had persons like Dr. Dial Singh that spoke about mental health. So the program brought a level of awareness where persons came out to actually contact us via the phone or at our ministry's Facebook page, right? So they reached out to us for assistance. So the radio program has been very, very effective, not just this year, but previous years.
And what are some of the topics that you guys deal with on the radio program?
But we deal with single parenting, co-parenting, mental health and wellness, elder abuse, domestic violence, child abuse, communication, and family values. Such topics that relate directly to the family is what is addressed at the program.
Okay. And Farisha, can you tell me, what are some of the challenges that you guys face as social workers working in the field, be it virtually, be it, when you're out in person? What are some of the common challenges that you face?
So in light of COVID, because we're speaking COVID, the challenges that we are facing right now is its limitations based on our clients' access to, let's say, the internet. Some of our offices are in rural areas, so there isn't everybody who's able to access the internet, or they aren't able to, have the technology that is required to reach us via the internet. That is particularly the major limitation that we had in practice during this time. But what we try to do as social workers is to keep abreast, keep in contact with our clients via telephone. So we would go into the offices, and even though they aren't allowed to come into us, we kind of contradicted that with us reaching out to them and letting them know. And as I indicated earlier, we also had where the ministry had set up a hotline for us where we were able to give the psychosocial support. So the limitations were there, but somehow or the other, as social workers, we found innovative ways in which to work around it, because that's part of the social work profession, where you have to go every which possible way in order to meet your clients' needs and to ensure, because this pandemic, it has really taken a toll on families. Crisis, the breadwinners, they were out of jobs. Families, for the first time they were seeing each other in a very long while. Husbands weren't accustomed to having their wives at home 24/7. Likewise, wives weren't accustomed. Children weren't accustomed with their parents being there. So there were a vast number of, issues that
had to happen.
and issues that arose because of those things that were highlighted. So basically, the major limitation, I would say, going back to the question that you asked, was the technology and them reaching out to us prior to this hotline being set up and all of that.
I want to know if you the Family Services Division, are you guys equipped to deal with those huge jumps in numbers and percentages that you spoke about earlier? You said that the child abuse rate went up so much and the domestic violence rate went up 100%. And are you equipped to deal with that huge jump in number?
Well, that's a tough question, but I will say that we are prepared to do our best.
Right.
And what we do is we collaborate with other agencies. So if there are issues that arise as you identify child abuse and there's something that we can do on our end, we will do it, but we also work in conjunction with the Children's Authority, where we liaise with each other and get the best outcome of the situation. So I believe that based on that, collaborating one with the other, it will have a great impact on how the issues are addressed as they come along.
Anuola, can you tell me if there's a system in place for this collaboration to be done as easily as possible? I know that, for example, the medical social workers would fall under the Ministry of Health as compared to the other social workers who fall under different ministries. And I know that sometimes there's a lot of red tape to get information across from ministry to ministry. But have you all figured out systems in place that you can mitigate that as much as possible?
Right. Personally, as social workers, we have to use tact and we have to be very creative. So what we do, like for example, if your office is in Couva or in Arima, you must know who your medical social worker is within the local district there. You must know your community police. So what we do, it makes the job a little easier, that you have a lot of case conferences. So therefore, when these matters come in to us or from Ministry of Health, we collaborate over the phone or we meet previously we met in person and we would discuss the cases. It makes it a lot easier that, as I said, that you work with your community police, you work with your school social workers for your area, your medical social workers for your area to get the job done effectively and in a quick space of time, I should say.
A timely manner as well.
Timely manner, yeah.
P.S., can you talk to me about your work regarding the regional responses for social welfare for families in particular?
Just before I get to that question, Jiran, I just wanted to add to what was being said about the ministry's capability, capacity, and readiness in terms of the period coming up to respond to the impact. National Family Services Division is a very critical division in the ministry. We are actually focusing on that division also in terms of ensuring that they have the staff that they need, looking at, interviewing and building up the human resource capacity. And we are also working on the interagency protocols, like Anula and Farisha just indicated. Those are the informal networks, but we understand that it's important to have the formal networks working, and we have been trying to ensure that we establish that interagency protocol for critical incidents and also for doing that casework with the clients that is necessary with the various social workers across the social sector. Apart from that, we are also trying to promote the working of committees, interagency committees, where we have all the relevant stakeholder agencies represented. And so they could bring to the table every month the issues and resolve them collectively. So those are some of the strategies that we are using for networking and for collaborating with the various agencies and ministries that we have to in order to deliver on our mandate. And I thought it was important to just bring that to the fore.
I appreciate it very much.
Yes. So going to your question, Jaron, could you repeat it?
I was asking about your work regarding the regional responses for social welfare for families.
The regional responses for social welfare. Could you elaborate a little more? Is it, what are we providing out there in terms of the social services for this particular period? Is it that?
I was speaking specifically about your work with ECLAC.
What we've done?
With ECLAC? I believe it's ECLAC?
ECLAC.
ECLAC, sorry.
Right, no problem. But we would have partnered with ECLAC in particular with regard to our standard means test that we introduced in 2018, which is the test that we actually use to determine eligibility, at least the initial eligibility criteria for persons who would be applying for our grants. And we would have worked with ECLAC in terms of the review of that standard means test. We also work with ECLAC with regard to the survey of living conditions measurement, whereby we measure poverty and determine the poverty line and the vulnerability line and those sorts of measures. So they're one of our partners in terms of the international development agencies.
And P.S. applying those I guess the way that you choose who you're choosing to give assistance to and all that stuff, especially in this time of the pandemic. I know that the Prime Minister and several ministers during various press conferences keep mentioning people trying to get into the system and cheat the system in ways to get I guess more out, as much as they possibly can get out of the system. How are some of the ways that you're dealing with that situation?
Well, I just want to mention that those are the few persons in our population who would seek to defraud at a time like this, but the majority of persons have really come forward to volunteer. I need to mention that we have had persons coming on board with the ministry volunteering their services for the past 2 months, whether it is to answer calls in the call centers or take applications. And I really want to applaud those persons publicly as I have the opportunity. But in terms of the fraudulent practices, what we have done, we have put a robust system in place to ensure that we can determine persons who are seeking to defraud. So we have a number of persons validating the applications as they move forward to ensure that the information is correct, and also our ICT system has been established in such a way that it can also determine if people have submitted triple applications, which we have found some persons have done so. And it could be that they just wanted to ensure that their application gets in rather than to defraud. So we do have that. So it's really our ICT system, the validation system that we have in place, and also the checks and balances that we have also pursued to ensure that we have a system that could stand the test. So
okay, thank you.
Those are some of that we put in place.
Thank you very much for that, PS. And I appreciate you mentioning that it's the few people trying to defraud the system, because I know that sometimes we tend to take it for granted that they are in the majority when in fact they really are in the minority. So I want to encourage you guys to please call in at 622-4141 extension 4. You can ask the PS or any of the family services social workers that we have in studio and online with us the questions that you may have burning inside of you. And in the meantime, we'll take a quick break and be back right after this.
Know the ABCs of child protection. A. Always look out for abuse. B. Be aware of your environs and plan for safety. And C. Call the Children's Authority at 996 or Childline at 131 for help. Child abuse is everyone's business. A message from the Office of the Prime Minister, Gender and Child Affairs.
Protect yourself from COVID-19 novel coronavirus. Cover your nose and mouth with disposable tissue when you cough or sneeze. Discard the tissue immediately. Healthy me, healthy you, healthy Trinidad and Tobago. A message from the Ministry of Health.
Makeup is my joy. There's a slight difference doing makeup for TV and doing makeup in real life. As a makeup artist, it's my responsibility making sure the on-air talent always looks their very best. Because trust me, they don't always wake up looking this way. It's really exciting seeing the finished product on TV. And that's why I support TTT, and you should too, because TTT lives for local. My name is Delia Benjamin. I'm a professional makeup artist. I support TTT because TTT lives for local.
Protect yourself from COVID-19 novel coronavirus. Cough and sneeze into the crook of your elbow if you do not have a tissue. Healthy me, healthy you, healthy Trinidad and Tobago. A message from the Ministry of Health. Protect yourself from COVID-19 novel coronavirus. Wash your hands frequently with soap and water or use an alcohol-based hand sanitizer. Healthy me, healthy you, healthy Trinidad and Tobago. A message from the Ministry of Health.
And welcome back. And you are viewing Living with COVID-19, a presentation of the Ministry of Social Development and Family Services right here on TTT and TTT Live Online. And I want to remind you that you can call in at 622-4141 extension 4, and you can join the conversation, ask your questions to either of the social workers that we have in studio or online, or the Permanent Secretary at the Ministry. I have a question for the Permanent Secretary. Can you tell me what some of these systems the Ministry has in place for support for its own staff during this time?
That's a good question, Jiran. I want to begin by indicating that as we return to work, some of our divisions were not out to work. However, because we were deemed an essential ministry, most of our a large proportion of our staff were out for most of the time. However, with the return of the other segment, part of the staff complement, we have ensured, firstly, that persons are safe. We are looking at the protocols. We ensure that persons got at least one mask per employee. Some of the offices where we have traffic, just to say, over the 2 months, we have had as much as almost 30,000 people coming into our offices over the 2-month period to submit their applications and so on. So the first thing we've done is to ensure that our family members, which is the staff, that they are safe. So in the boards, for example, we have ensured that there are those partitions for the client staff interface, And we have also ensured all the PPE that must be provided to staff has been provided. So in the situation of safety, health and safety, we have been working to ensure the protocols are in place. The issue also of staff well-being came up, so we have also arranged for each division to have counseling done as they return to the office, because having been away for such a long time, some persons have to readjust, and also they have been at home, and so leaving home again, where they have become comfortable with their family, we understood that there would be need for some counseling. So every division has been scheduled for counseling sessions from the National Family Services Division. The issue also of staff and the impact that the COVID measures have had on their families came up, and we have been looking at a committee we call the Staff Care Committee that will be looking at ways that we could address the issues of the staff as they return to work. This is the psychosocial and socioeconomic issues related to the staff. So these are some of the measures that we are looking at, and some that we have already started putting in place to ensure the well-being and the welfare of our staff.
Okay, thank you very much, PS. Anuola, can you tell me, I understand that you're a parent, and as a social worker in the Family Services Division, like how do you feel about some of the cases that come your way?
Great question, Jaron. Great question. I tend not to take home whatever have been divulged or released in the office. I tend not to bring it home, because I have to continuously work on self to ensure that, because you're human. First thing will come up, Lord, if this is me, what will I do? All right. But some of the same counsel and guidance that I would give to clients, I would apply to my own life, or my in terms of caring for my daughter. But I ensure that I learn from my clients. I learn from some of the issues that will come before me, and I would know in terms of putting better things in place. So, for example, my daughter, she's not permitted to be with anyone. I must know who she's with, and she's really with family, and I could vouch that it's a safe environment. So I tend not to be paranoid, because you can easily slip into that if you're not careful. All right. But as a parent, as I said, I do not bring home the whatever have been shared there at the office, because else I will not be of no use to her or even other clients that will come along.
Yeah. Does it ever get overwhelming? I know that like in this period where things have escalated a lot, does it get overwhelming dealing with all of these things and then trying to put them down to go home and deal with your life?
Yes, they do. They do, and in all honesty, it gets overwhelming at times. But as an individual, as a social worker, I have to have my outlet. So I have friends, I have other friends and counselors that I would vent, because I need to vent as well, because every day you're listening to such heavy stories and coming up with solutions and ideas with the clients to make them better. And at times when you feel like you have to go over and beyond a lot of times, or you feel like you don't have enough resources to assist clients, you tend to get a bit frustrated. But, it's so easy. You can call on your other colleagues to kind of like vent. So that we may have a quick case conferencing without sharing too much, upholding confidentiality. So and also my faith in God, because I pray a lot, my church family. So it helps a lot. All right. So that I would not become overwhelmed and
of no
unable
use.
to function.
Yeah. Farisha, can you tell me, but we have a question from social media actually. Somebody's asking, how can persons access counseling from the ministry?
So they can access counseling calling 623-2608 extension 6701 to 6707 and just provide us with your name and telephone contact as well as the area in which you reside so that we can have the officer who lives closest to your jurisdiction. They will be able to contact that client and we will take it from there. So it's not a very difficult process. All you need to do is call us and we will make the necessary arrangements. Can you give us that number one more time? 623-2608 extension 6701 to 6707.
Okay, now tell me, working out of the, you told me before that you worked out of the Rio Claro community. Some of the things that you would see come to the forefront and some of the solutions that you and the clients would work out together, do you see them being put in place and actively helping the situations that you are met with?
Yes, it is effective, but it is based on the willingness of our clients. So if our clients come to us with a particular problem, the dynamics changes as persons change because no two individuals are the same. So one of the things that we do is that we meet the client's needs based on their strengths. So a client may come in and he or she is a victim of domestic violence and we build upon the strength that is there. So the situation may be looking grim to that client, but then we have to find the one particular thing that will bring hope to them. And we use that to build on. So within that client and his or her environment and support system, this is what we use to make that intervention and make it as effective as is. But as I said, it is solely based on the client and how much work that client is willing to put in, because we as social workers can say, well, this could work, and we could give you options, but then it's up to you to take those options and use it as a guide, because we do not direct the clients as to how you should, function in order to meet that goal. But it's up to you. So we work hand in hand in order to meet that goal. So it's totally up to the client.
How often do you guys meet with clients?
It depends on the situation. So if there's a situation that's elevated and it must be contained, we try to meet with them every week because we are at our offices, some of us on a daily basis, some of us, 2 to 3 times per week, based on the offices that we hold. So we try to meet with the clients. Then as time goes by and the intervention steps in and the processes are there, we reach from one phase to the other. So say we are in phase 1 with a new client, we would meet with them every week, and as they wean off the system and empower themselves, we meet less time. So it may go from 1 week to 2 weeks, from 2 weeks to once per month. So it depends on the progress of the clients and how fast or at the pace in which they are moving.
Okay. And we're inviting you to be a part of this discussion. You can join in by calling us at 622-4141, extension 4. And we'll take your calls. You can ask all the burning questions you want. You can also ask your questions via social media at TTT Live Online or on the Facebook page of the Ministry of Social Development and Family Services. So we'll be right back after these short messages with your questions. Just send them in.
Protect yourself from COVID-19 novel coronavirus. Cough and sneeze into the crook of your elbow if you do not have a tissue. Healthy me, healthy you, healthy Trinidad and Tobago. A message from the Ministry of Health.
Over the past few months, there has been a shift in our way of life due to COVID-19. As part of the new normal, here are some measures that you should put into practice to protect yourself and others. Wear a mask when you go out in public. Keep your distance from persons at least 6 feet. Wash your hands often with soap and water, or in the absence of soap and water, an alcohol-based sanitizer should be used. Avoid touching your face. Cough into a tissue and cover sneezes with the inside of your elbow or upper arm. Clean high-touch surfaces frequently, including tables, doorknobs, light switches, countertops, handles, desks, keyboards, toilets, faucets, and sinks, etc. Stay home if you are ill. Last and certainly not least, remember to be your neighbor's keeper. Be kind and show empathy. Stay safe, TNT. A message from the TTT Limited Media Network.
End gender-based violence now. See it, stop it, report it. Victims or observers call the National Domestic Violence Hotline at 800-SAVE. That's 800-7283. A message from the Office of the Prime Minister, Gender and Child Affairs.
Protect yourself from COVID-19 novel coronavirus. Wash your hands frequently with soap and water or use an alcohol-based hand sanitizer. Healthy me, healthy you, healthy Trinidad and Tobago. A message from the Ministry of Health.
HIV testing is free, safe, fast, and confidential. Know your status. Get tested today. A message courtesy the Office of the Prime Minister, National AIDS Coordinating Committee.
And welcome back. This is Living with COVID-19, a program, of the Ministry of Social Development and Family Services. And today I'm chatting with Mrs. Jacinta Bailey-Sobers, who's the PS of the Ministry of Social Development and Family Services, Ms. Farisha Mohammed and Mrs. Anola Cox Olubade, both are social workers at the National Family Services Division. I have a question for the PS coming from social media. And that question is, are social workers available after regular working hours to provide counseling?
Generally, our social workers will work from the working hours 8 to 4, but I am sure Farisha and Alola would let you know that because of the type of work that they do, that they also facilitate clients outside of the normal working hours, depending on the need. I'm sure they could attest to this.
You want to jump in here, Farisha?
So yes, we do meet clients outside of the regular working hours because of the fact that some of our referrals, they are delicate situations. There are some that comes from the courts and various other avenues that we gather our referrals from. And based on that, sometimes we are lenient in how we meet with clients. For some reason, a single parent may not be able to take time off from work and they have to access the services at the division. So we make way for those situations where we provide the services to them after the regular working hours.
P.S., I know earlier you spoke about parts of the policy and the strat plan and all that stuff. I was just wondering, I was reading online about a parenting policy that you guys have in place. Can you tell me a bit about that?
Yes, a very critical aspect of our work is policy development. With respect to the family, we have developed policies such as the parenting policy. We have a draft family policy. We had an aging policy that is currently being reviewed to be revised. We have a national policy for persons with disabilities. So policy development is important because, of course, it's really the guide, the strategic direction for these particular areas of focus of the ministry. So the parenting policy was actually laid as a green paper in Parliament. We have done some focus group sessions. We have done some consultations to get feedback on the policy. We are at the place right now where we are the last leg actually of the consultative process, where we will be having some focus group sessions with very important groups, such as I know we have to do some with children who are in the schools, and well, that's on hold now because schools are closed. So we may have to find an innovative way to treat with that. We had to get feedback from particular parents, such as parents of children with disabilities, to interview young people in our institutions and also in the prisons, and other particular kinds of groups, to get the feedback to finalize the policy so that we can actually get it approved from in cabinet. We are very seized of the need to complete this particular policy because parenting is such a huge issue in our population. We have juvenile delinquency, we have parents who can't cope with their children and end up taking them to the doors of the court as, unable to cope with them, and the courts having to find somewhere to accommodate these children. And I'm sure the social workers could tell you a lot more about what is happening with parents in Trinidad and Tobago and the types of support that we have to provide to parents in this particular area.
Well, I want to invite Anura to tell me some of the things that you guys have been dealing with and having to assist with in terms of parenting in Trinidad and Tobago.
Right. So most times we have cases coming in from the court, as our PS mentioned, that they're unable to cope. And conducting the initial interview, we tend to we realize that persons have difficulties in communicating. So parents do not know how to relate with their children with their parents. And then some of the way they would kind of rebel to some of the parents' rules or desires. And as they come into us, this is where we normally have to sit them down. So personally, I have had cases where I had asked parents, when was the last time you hugged your child? And the child would just burst out into tears because mommy and daddy, whether they're separated or not, busy or they are great providers, they'll ensure that their needs are met for school and so forth, but really finding out who their child is, who their child have been, how they are developing, there's a disconnect. And oftentimes, this is where we have to be creative in sitting down with clients and kind of mapping the way forward with them. Of course, not imposing our values, but just to find out where they are at. So we begin where they are at and then sort of shed some light in that area. Because oftentimes when they go before the court and the children would come in as like, why I have to go through this, why it is that mommy or daddy, they give up on me. And nobody really understood what I was trying to say all along. So oftentimes we have to be that middleman, that broker in between to ensure that parents really understand. Because the child that you had at 5 is different from 15, at age 15. So there's a deep interest. Yes, it's good to focus on the educational needs and to ensure that they have savings and all these little things, but just that nurturing aspect, that active listening. A lot of times we tend to miss out on that and really sitting down to find out how was your day-to-day. What do you like? What are you interested in? If it is that you want to become a police officer, why? Sorry, something came up on my computer.
That's okay. And I wanna. Yeah, I'm still hearing you and seeing you very clearly. But I wanna toss across to Felicia. We have just about 5 minutes before we have to wrap up the show today. But I want to know if you can give, I know it's probably difficult to give general advice, but I'm sure that there are basic rules. Like she's saying, listen to your children, talk to your children, hug your children. But are there basic rules that you can give that would give, guidelines towards families improving their relations?
So as Aniola would have indicated, we stress greatly on communication because nobody are mind readers. We aren't mind readers. If we were, then society would have been in a better place.
Much better place.
But, we have to work with... So my advice would be generally that you communicate. If you, as a child, you are hurt about something, let your parent know, or your relative or whoever is your caregiver, let that person know this is what is affecting me. I am affected because of the way you speak to me. I'm affected because of whatever it is. And as well, a parent, if you and your child has a conflict, or you and your spouse or whoever it may be, there's a conflict, then the only way to resolve that conflict would be through dialogue. And we need to have healthy dialogue. So at the end, as a parent, you may not always be right, but there was a discussion and a resolution came out as a result of that discussion. So those are the general guidelines with regard to healthy family functioning, as well as a proper family support. So you may be a woman from a single parent home and you rely heavily on your brothers or your uncles or your father or whoever it may be in order to provide that support to you as a single parent, vice versa. You know, if you're a dad who is a single father, you rely on your mothers, your sisters to provide that nurture to your boys, you know. So it is basically the family support and communication within your homes that will assist in healthy family functioning.
Okay, and can you tell me, Anuola, if you know about any support systems that are in place for parents and families with members of the family who may be substance abusers?
Okay, I know out of under Ministry of Health in Cora, there are support groups there and counseling being done there for persons, and also under our ministry under the Piparo, yes, Piparo Empowerment Center. All right, with persons, and we have had feedback, because I personally had a client there some years ago, had received the support and encouragement and the accurate counsel and guidance as to how to overcome this. So the two of my head right now is Piparo Empowerment Center and under Ministry of Health.
Okay. I want to ask the PS before we wrap up, if she can give us a quick update as to the situation with the grants and the grants assistance. People have been anxious about it, and they always ask, it's always the burning question as to how it's been going. Can we get an update on it quickly?
Sure. So the ministry, of course, with the onset of the pandemic and the stay-at-home measures, we would have put a number of programs in place, apart from topping up our existing clients of public assistance, senior citizens who applied but did not get processed, also got some support. Disability, persons receiving disability, but the social assistance grants is what I think they're talking about. At this point in time, we have targeted about 50,000 applications coming in. We are close to that. And also we would have paid at the end of Friday, we would have had more than 20,000 persons being paid. Of course, this week we are going to be expediting. We have put a number of things in place to expedite the payments this week. We have started paying rental, and some landlords would have gotten calls because we are actually calling the landlords to indicate that they should come in for their check. And we are also calling the tenants at the same time, so that they will be aware that the landlords have received those payments. So as it is, we are working to pay at least 75% by the end of next week of those 50,000 applications that we had targeted for to the clients, the applicants. At this point, we would have paid almost 41 million in those social COVID assistance grants, and we are over the 100 million mark in terms of the expenditure on these COVID social assistance measures.
Thank you very much, PS. I'm Jayon Remy, and I've been speaking with the representatives from the Ministry of Social Development and Family Services. With me has been Mrs. Jacinta Bailey Sobers, the Permanent Secretary, and social workers Farisha Mohammed and Mrs. Anuola Cox Olubade. Join us next Sunday at 3 p.m. and we will be discussing mental health and wellness, as well as caring for persons with disabilities. I want to thank you ladies very, very much for your enlightening discussion today.
Thank you for having us.
No problem. We'll continue next week. Living with COVID-19.